RSV, COVID, influenza. It's a triple threat this time of year. We felt it was important to talk with Pediatrician Dr. Cyrus about why we're seeing an increase in these health concerns in our children in our community. I know we've talked about RSV a lot. Yes. The hospitals had been full at one point, but it doesn't always mean hospitalization?
Doesn't always mean hospitalization, and that's the good thing about it. Obviously, if you're concerned, see your doctor. Get in that day. Don't have them push you off till a week from now, but they need to be seen right away. The children can be really appearing sick. They can respond something into the office. We can give them treatments in the office and they respond well. We can send you home with certain treatments like a home nebulizer. And so it's important from that standpoint to see your doctor and make sure that they are going to be okay. If they aren't, they can be hospitalized.
Let's talk about RSV, what it is and why it is so important to get the child seen.
Well, the important part about RSV is that it's kind of unpredictable. Much like COVID was unpredictable, the flu is unpredictable. The idea is that if you're concerned about getting your child, get them into the physician and let us evaluate the child, because many times they're sucking in between their ribs. They're really using what we call accessory muscles to breathe. They should be breathing nice and easy, and they could be breathing 100 times a minute if you could, but those people would be hospitalized. As you can see, there's multiple hospitalizations every year, anywhere from 58 to 80,000 hospitals just estimated on how many children. And of course, the biggest issue is our younger children. Children under 1, it's obviously the #1 cause of pneumonia in this age group.
Now, we want to talk about, there are maybe some predisposition. I mean, some of these, if you have a child that has already underlying problems.
Exactly.
So who, I guess, is at risk?
Yeah, I mean, think about the risk factors, or who were you concerned about? You know, any child that is premature because of their lungs, their prematurity is a concern. Their organs, their immune system. Any child under 6 months of age, obviously, they don't have that cough effort. They don't have that ability to blow their nose or clear their airway, and so it concerns. And obviously, any chronic or heart or lung disease, and typically we see that in the course of the premature child, and then the weakened immune system. Children under 6 months of age don't have the best immune system anyway, but and when you have that concern, they can get sick, and they can get sick quickly.
Let's take a look at some of the factors. If these are things happening in your household, this is when you need to call the doctor.
Exactly. So you think about high fever, severe cough, again, that sucking in, be using those extra muscles, trying to breathe, wheezing, You hear that sound, it's concerning because their airway is narrowed. Obviously, blue lips. Anytime you have blue lips or blue around the mouth, they're not getting enough oxygen into their system, and they need to be evaluated. And if the doctor is full, take them to the emergency room. I would not advise taking them necessarily to an urgent care right away if they're that sick, because they may need to be admitted. Obviously, diapers that are fewer wet diapers, because they're not able to, because they're concentrating on breathing, they can't drink, eat like they normally would, so they can get dry. And then when you get dry, we get thicker, mucus and such.
So sad. Obviously, we talked about, are there ways to prevent this, I guess?
Well, obviously, it's the same thing that we talk about all the time about the prevention. Cover your cough, stay home if you're sick. Children, if they, wear a mask, wash your hands, obviously. Those are all the same thing. We look for flu, we look for COVID. We've said it over and over and over again. We show that, if we stay away and we stay home, we've seen this during the COVID outbreak, is that when the children were at home, the illnesses really, really dropped off. We basically isolated everybody, and it was effective. But the concern is obviously being out of school, but now we've got ability to basically do virtual school and such, and try to keep that going and not have it for so long. So we can blend these techniques and blend these treatments in such a way that the spread is least and the learning is most.
That's great. All right, thank you so much as always, for coming in. We also just want to hit on getting flu shots for little ones, getting the COVID vaccine. Those are the ways.
6 months and older.
Yeah, it's important.
6 months and older, very, very important.
We'll see you again next month. Thank you.